Cardiovascular disease is the #1 killer worldwide. According to the World Health Organization survey, it appears that ischemic heart disease, angina pectoris, or myocardial infarction accounts for 1/3 of all disease deaths. The main risk factors for cardiovascular diseases are hypertension, hypertriglyceridemia, low levels of HDL cholesterol, hyperglycemia, and obesity. If you have 3 or more of the 5 risk factors, you are diagnosed with metabolic syndrome. Metabolic syndrome is especially vital for developing cardiovascular diseases. Individual risk factors of metabolic syndrome alone can increase your chances for having a cardiovascular disease. But when you have 3 or more risk factors, this means that you have metabolic syndrome, and probability of a heart disease increases exponentially by 8 to 10 times. We, as medical staff and patients, therefore, have to recognize the importance of metabolic syndrome and the risk of cardiovascular diseases. The Cardiometabolic Syndrome Society will take the initiative in developing effective preventative measures and clinical guidelines for metabolic syndrome. The Cardiometabolic Syndrome Society is a joint organization composed of cardiologists, endocrinologists, exercise and nutrition specialists, and basic research scientists. The Cardiometabolic Syndrome Society was first launched through a founding symposium in 2014 under the Korean Society of Cardiology. In 2019, we expanded as the world's first independent academic society solely dedicated to cardiometabolic syndrome. Since 2018, we have hosted the Asia-Pacific Cardiometabolic Syndrome Congress. The APCMS is the world's first international conference dedicated to the cardiometabolic syndrome. Cutting-edge research on prevention and reduction of cardiovascular diseases through systematic research and comprehensive management of metabolic syndrome is presented. The APCMS also invites world-class scholars and provides joint sessions with leading foreign academic societies. Many research prizes and grants are awarded as well. Next year's APCMS will be held under the theme of Innovative Proposal for the Prevention and Management of Cardiometabolic Syndrome. Professor Robert Eckel from the University of Colorado receives the 5th Research Achievement Award. The following year, Dr. Joseph Hill, editor-in-chief of the medical journal Circulation, and a professor at the University of Texas Southwestern Medical Center, will receive the Research Achievement Award. The prevalence rate of metabolic syndrome has increased over the past 12 years, and the increases in Gangwon-do, Jeollado, and Chungcheon-do provinces were especially notable. We are also publishing the Metabolic Syndrome Treatment Guidelines 2021 for efficient management of metabolic syndrome for both doctors and patients. The new guideline is raising attention among the scientific community, as it specifically provides ways to do a successful therapeutic lifestyle to minimize drug prescriptions. The Cardiometabolic Syndrome Society is also currently in progress of conducting a prospective study examining the incidence of cardiovascular disease in patients with high risk of metabolic syndrome. In the autumn of every year, the fall scientific session is held. The latest research achievements in the field of cardiometabolic syndrome are presented and discussed. Recent results by the members of the society are published through the Cardiometabolic Syndrome Journal. The 3rd week of May every year is designated as Cardiometabolic Syndrome Week. We conduct public health educational sessions called the Colored Ribbon Campaign throughout 13 university hospitals nationwide. Cardiovascular diseases are alarming signs for a healthy life, but these diseases can be prevented. Proactive management of cardiometabolic syndrome and therapeutic lifestyle improvement is the solution. We can lower the incidence of cardiovascular diseases if we study the disease in a holistic point of view and treat or educate the patients. The Cardiometabolic Syndrome Society will be your companion along the way.